Good afternoon, everybody. We'll give everyone a few more minutes because I see people still filing in. All right, we'll get started because we have a great presentation this morning or this afternoon, depending on where you are calling in from. So welcome everybody to Thriving Beyond Survival, Advancing MMIP, MMIW, UIO Programming. This is a Community of Learning series, session 3, and our final session of our 3-session series in the NCUE Reclaiming Our Future, Indigenizing Strategic Planning to Address Social Determinants of Health. In this session, our presenters, Dr. Yvonne Ito, Public Health Manager at NCUE, Dr. David Pashane, PhD, HHS, IHS, DVH, National Data Coordinator, and our own Sabu, Public Health Associate at NCUE. They will share the best practices that support advancing MMIP, MMIW, UIO programming. My name is Liz Best, and I'm a Program Manager of Technical Assistance with the Technical Assistance Research Center, otherwise known as TARC at NCUE. And joining me from the NCUE team are Molly Siegel, Public Health Associate, Abby Maho, Public Health Program Manager, Rachel Dow, Communications Associate at NCUE, and Antoinette Asensio, the Culture Keeper at NCUE. We are very honored to have all of you here today, and we kindly ask, if you haven't done so already, that you place your name, your organization, your tribal affiliation, and title into the chat box. In addition, we welcome any feedback you would like to provide about your webinar experience in our survey, which is also posted in our chat box. Next slide, please. Next slide, please. Great. So before we get started, there will be an opening prayer to start today's session to get us all in a great place. I will now hand off the mic to Abby Maho to lead today's opening prayer. Abby, the mic is all yours.
Thank you. Shidian dina anotlini ko citizen be hasti. Halani dina abjin dahot latnits hajo she haiskaya hatno dahonne ago. Hashit abjin dahot doshi bitkata hodot ida big ashi do ilke dahot inda ako halet out bansaha kesto be benhat do baya ati igi be benich in dahot accordion dina anotlini who needs so in the hand dile qualki kaigi not ani dan linigi yan seta keso hajo obj do be hatet enigi do adeshi yukalo elhine kahigi jonago yene dlo do li benahat do yansa keso ado quote nabijin dahot baya atki egi pagan kahon dato kapik et kaho bikeya dado jeno yidilta no tlodole tibe shitsotozin shandedo lel. Holy ones, we pray to you all. We ask that you guide, protect, and be with those affected by the imbalances of the human being, which has caused in some cases absence of so many of our relatives. In our world today, known as missing, murdered Indigenous peoples, we ask, Holy Ones, that you guide them out of pain, sadness, suffering, loneliness, and return them to love, balance, and harmony. Through our prayer, we ask the Holy Ones to guide us to better understand, approach our people's imbalances. Through our gathering today, we come to learn with compassion and humility. Empower us to conduct our work with openness and awareness. We offer thanks for allowing us to work with our people from various clans, bands, tribes, nations, pueblos, and villages. With this, Wajonahasli, 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 Do Wajonahasli. I turn it back to you, Liz.
Great. Thanks, Evie, for opening our session with such a great prayer. Next slide, please. For those of you who are unfamiliar with NCUI, here's a little background. The National Council of Urban Indian Health, also known as NCUI, is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUI is the only national representative of the 41 Title V Urban Indian Organizations, or UIOs, under the Indian Health Service in the Indian Health Care Improvement Act, or IHCIA. NCUI strives to improve the health of over 70% of the American Indian Alaska Native population that lives in urban areas, supported by quality, accessible healthcare centers. Next slide, please. We will begin by going over a disclaimer for today's session and a few housekeeping items, and then we'll move on to introducing today's presenters. Due to the nature of Thriving Beyond Survival, Advancing MMIP UIO programming topics, we want to ensure a safe and comfortable participant experience. We kindly ask for the following. Please refrain from sharing the Zoom link or access code with others. Please be mindful of your Zoom environment. If a participant cannot be alone and does not have access to headphones, please ensure individuals in the room also agree to the confidentiality agreement. NCUI will have support staff and a virtual wellness breakout room for social emotional support if needed. Screen sharing at this time has been disabled, and if you feel uncomfortable during this session, please feel free to drop off at any time. If you would like additional assistance, you can call the National Suicide Hotline at 988, Strong Hearts Native Helpline at 1-844-762-8483, or Hope for Wellness Hotline, 1-855-242-3311. And Molly, maybe you could drop those into the chat as well. Next slide, please. As a reminder, this session is being recorded. All mics have been muted upon entry. We always encourage participation and engagement in today's session. We invite all the participants to turn on the camera and post questions and comments in the chat box. There will be opportunities to also participate in Q&A and discussion throughout the agenda today. Also, please note the QR code on the bottom of this slide. If you scan it with your phone or tablet, you will be taken to our session feedback survey, where you can leave your comments on what you liked most and how we can improve these sessions. Your participation and feedback is always greatly appreciated. Next slide, please. This slide features some information on how to use Zoom. For those that are already familiar with Zoom, you will have seen this before. But at the bottom of your screen, you can find the chat box feature. Click on to enter the chat, and please enter your comments and questions there. Next slide, please. Additionally, we welcome and feel free to use icons and emojis in the chat throughout this session. Next slide, please. This slide features some information on how to ask for social or emotional support. At the bottom of your screen, you can find the chat box feature. Then press on the downward arrow and pick on NCUI's social emotional staff, Antoinette, and let her know you want to go into a wellness breakout room. Next slide, please. We will also be having a Padlet activity during today's presentation. To access the Padlet activity, please use your phone to scan the QR code during the activity portion of today's session. A link will also be provided in the chat during the activity portion of today's session to access the Padlet activity. Next slide, please. This slide features some information on how to use Padlet platform. Once you get into the platform, you will see questions. Click on Add Comment of your Padlet screen, and at the bottom of your screen, you can find the chat box feature. Then type the question or comment into the comment box and press Enter. And if you have any problems at all during that time when we're in this activity, you can always post a question in the chat. Next slide, please. Using the emojis option. Additionally, feel free to use icons and emojis in the chat throughout this session. Next slide. As shown in the agenda, we will begin our presentation shortly, and we'll follow that by an amazing Padlet activity, and then lastly, a Q&A session at the top of the hour. And we will end our evaluation and upcoming events and adjourn at 3:15. Next slide, please. The learner objectives for today's session are as follows. 1, understanding the definitions and the impacts of MMIP. 2, developing a basic understanding of DBH-IHS's objectives on MMIW, MMIP, NOFO, and data from MMIP grantees. 3, how to address MMIP. 4, exploring practices for coordination of care, caseload management, time management for DBP programs that work with MMIP cases. And then lastly, navigating the funder philanthropic sector by using a funding map to help identify MMIP funding for your organization. Next slide, please. And now I have the honor of introducing our 3 speakers. We have Dr. Yvonne Ito. She's a public health manager for the Research and Public Health Division here at NCUE. She has 18 years experience working with Indian child welfare as a social worker and over 16 years experience in behavioral health, and has expertise in trauma-informed care, suicide prevention, crisis interventions, and working with chronic substance abuse issues. She's been with NCUE since 2021 and is currently working on emergency planning and MMIP projects. Prior to NCUE, Dr. Ito has served the American Indian Alaska Native population by serving in Alaska and several reservations of social service and social justice. Yvonne is married to a social worker, and together they've adopted 5 children and have 3 children on their own. She loves advocating for the rights of foster children, MMIP survivors, and volunteering as a guardian ad litem. Next slide, please. I'm also honored to introduce Dr. David Pachane. He's a health scientist and organizational scientist serving as the National Data Coordinator for the Indian Health Service in Behavioral Health. He is a member of the Choctaw Nation of Oklahoma and is a U.S. Army National Guard veteran. He is a leading analytics services for developing protocol, prototype, field-tested verifications for local continuums of services in Indian country, focused on self-efficacy among youth and community reinforcement with spiritual health leaders. His federal experience with OMB, VA, NIST, FEMA, NIDA, HUD, HRSA, and IHS has focused on human risk and risk mitigation, including use of biomedical technologies. He earned his PhD in medical geography from the University of Washington and has degrees in behavioral organizational research and psychology. His projects and publications have earned the Federal Leadership 50 Award, Computer World Premier 100 IT Leader Award, Alaska Psychology Award, Health and Human Services National Award for Excellence, and the Army Achievement Medal. And lastly, next slide, please. We welcome Sabu. He is a public health associate for the Technical Assistance and Research Center at NCUE. He has over 7 years of specialized expertise focused on mental health, trauma-informed care, substance abuse, suicide prevention, health policy, and community development. He has been employed with NCUE since 2018 as a public health associate for the TARP Center. Sabu supports UIOs with capacity building, programmatic growth, and advancing Indigenous research. He serves as the program manager, advisor for NCUE's National Native Connections Grant, and leads a national AIAN behavioral health grant to support capacity for UIO youth programs. Prior to NCUE, Sabu developed training curricula for complex care nurse programs and trauma-informed care for tribal health centers. He received his master's in public administration, health service administration from the University of San Francisco, and is currently working on a master's degree in social work from California State University, Long Branch. Next slide. Now, without further ado, let's welcome Dr. Ito with a heart emoji in the chat box. The mic is all yours, Dr. Ito.
Thank you very much. Good afternoon or good morning. Good morning. So we're talking about MMIW, which is the most common acronym for Missing and Murdered Indigenous Women. Recently, we've come to call it MMIP for Missing and Murdered Indigenous Peoples. And we are moving forward to, I think it's going to start being called MMIR for relatives. So this is a movement that advocates for the end of violence against Native women. And it also seeks to draw attention to the high rates of disappearances of murdered and Native people, particularly women and girls. However, young boys and young adolescent men are becoming higher in the statistics. Over 84% of the Native American women have experienced some sort of domestic violence in their lifetime, whether it be domestic violence whether it be the violence from their homes or outside of their homes. And this has been astronomical numbers compared to what other populations suffer from. Native American women are particularly vulnerable to violence because the perpetrators often go unpunished. If crimes occur on reservations, there are various federal and state law policies that stop this stop the prosecution. So we ask ourselves, what can we do? What can we hold up? What are the things that we can do for this? And one of the questions I have, we'll ask questions later on, but we want to know what are UIOs and other people doing to help stop or decrease the MMIP? Do you have crisis intervention programs? Do you have survivor programs? Do you have prevention programs that can identify people at risk? So those are some of the topics that we're going to cover today. So just for the time being, I will be coming back to you later on, and we will now put you to Dr. Pichang. I don't know if I said that right.
Yeah, that was great. And thank you, Dr. Ito. Thank you, everybody, the staff, for putting this together. And I welcome everybody who's in the audience, and I appreciate you letting me speak to you today. I'm going to go over just some details from a perspective of Indian Health Service in terms of our programming. And then I will cover a little bit about concerns about the future and some things that we're looking at. So there will be opportunities in the future that we also want to bring to your attention. So next slide, please. So if I was to summarize our objectives from the Division of Behavioral Health, it's basically these four. Build mission partnerships through funding and consultation like we do with the urban Indian organizations. Build informative analyses to coordinate national interventions with tribes and with Congress. Verify efficacy and accountability in effective local services. And by that, we mean when we're looking at a local continuum of services, how do we know the work that the federal government does, whether it's Indian Health Service or not, is accountable to tribes and to the public? And are the things that are done, are they efficacious? And then four, removing any systemic service barriers through innovative testing. And by that, I mean, if there's areas in which we have the ability to look for any kind of improvements and they are going to have a long-term effect, we will try to pursue that and have an impact as in many places as we can. So those are our objectives, and that's basically how Division of Behavioral Health operates. Let's move to the next slide, please. So as it relates to MMIP, we're looking at the 10 projects that we funded in this past round through our notice of funding opportunity. That was back in November 21 and started in May 2022. And these are the 10 UIOs who are funded for our domestic violence prevention program. That's about as close as we get to the scope of MMIP. And if you're one of these UIOs and you're funded by us, then you are actively participating in some interesting changes in terms of how we collect that data, how we respond to you, how we support you throughout the scope of the project. So let's go to the next slide. Speaking of the scope of the project, this is the schedule. It's a 5-year program. And at the top level, you see the black text. It's describing data collection points in time. Sometimes we use terms that aren't the same terms that you will hear as one of our partners through the grant program. We'll refer to something as APR or semi-annual. It really just describes that we are going to update certain pieces of data as we go. And I'll describe that in a little bit more depth. And over that 5-year process, there is a course of evaluations, or the red text down below. And those will be led by myself or one of my colleagues. And that's engaging with the UIOs, finding out what has worked, given their data, where are their gaps, and how can we pursue changes in programming to better support what you're doing. And we know that all this is restricted to whatever authorization and appropriations that we receive through Congress. But as much as possible, we try to find ways to fill the gap. All right, let's go to the next slide, please. So part of us working with you as partners to coordinate national interventions, so it's above your local continuum of services. We do try to pay attention to how we collect data and how does that reinforce your efforts to reduce risk or to mitigate risk. So of course, we're focusing on what we would call causal data, sort of how things are affecting each other and how does that inform decisions. So we are making some major changes in data collection, as you'll see here shortly in the next few months, as we our area project officers reach out to you. And some of the attributes of that new program or that new design is that it's much more self-managed. We are putting back into your hands control over that data with a lot more online help and support. Also, we're trying to increase the utility of that data so you can use it at will. It's easy to review. You can enter data whenever you need to based on events or activities. And it's much more detailed in terms of what you can see and how you can use it. It's also self-paced. It's, like I said, it's open for your use. And there are some interims in the form so that you can collect data on a timely basis. And it's also much more high value. We're trying to integrate the items across programming so you have a better feel of things that may not be exactly within the program, but if they happen, you can also record those. If they don't, you can move away from that. It has a greater deal of community depth as well. So things that might come up that you want to record. There's less emphasis on narratives, less writing. It's much more about if this data field is applicable, I'm going to fill it in, I'm going to make it available, and you'll get that feedback. So we're going to design the online tools so that you can see analysis year over year on your own portal. Let's go ahead and turn to the next slide. I mentioned causal data earlier, and it's all about transparency and giving you some kind of robust analysis and helps in terms of understanding what factors are impacting your program, what decisions you need to make, and how we can be part of that relationship. And you see it's sort of a big circle. So largely starts out with understanding organizational capacity and what you're seeing in your catchment area, the area in which you serve. Also gets into coordinating partnerships. So we try to update that twice a year, be on top of what are the partnerships, what are your plans. It'll get into service designs or protocol designs, how you're training your personnel, technology capabilities, and then it gets into the real meat on the bone, you know, the service outputs, the client outcomes, client impacts, and system analysis. If some of this is rather new in terms of data collection, there are supports on the portal to you, but also we encourage you to work with your tribal epidemiological centers in your service area if you want to. You don't have to, And they can't see your data unless you give them explicit permission. So we'll be collecting those permissions as we go. And that kind of gives you an idea of how we're organizing that. Let's go to the next slide, please. So I already described what we're doing with domestic violence and what we're trying to do in terms of collecting data and giving you feedback. I just want to give you a couple thoughts on the big picture. So we do actively engage with other agencies. We don't have a huge effect on what they do, but for example, we are working with the Bureau of Indian Affairs Office of Justice, and we work with them to try to figure out how we can field test innovations or protocols that will improve services. Now, we generally think through this in three questions. First is, given the local continuum of services, how do we know we have enough support? And you'll hear folks raise issues about, are there investigators, are there prosecutors? Those are types of support we're interested in, but we'll find that through our partners at the Office of Justice. We have ideas about that. We've suggested to the Department of Defense and Department of Veterans Affairs to reach out to our service members who are members of tribes and recruit them after they separate, train them while they're in, recruit them to perhaps go into those fields of investigation and prosecution. The second question we tend to ask is, how are we reducing vulnerability? Good part of my career has been with reducing vulnerability or reducing risk. Early on, a lot of the field work I did was with 4,000 clients who were at very high risk and saw them on a regular basis for several years. And what I learned from that is we really have to focus on youth programming. How do we build up self-efficacy, self-care in youth? And if they do get into treatment and they do get resources, how do we know that those were the most efficacious resources? So we have a big emphasis on youth programming. And by the way, while we're building out our strategy for youth programming, we will be working with one of the UIOs that also works with inpatient youth. And we're going to use that opportunity to test out how in the future we might be able to work with UIOs, maybe on a contract basis, to work with youth. We'll explore that in the next couple of years. We'll figure out what works. Then my third question we try to ask is, what do we do about the data? How do we know what's going on the field, in the field, on the ground, the local continuum of services? And that gets to the meat on this slide. And I've kind of jumped around a little bit, but one of the problems that we see is that when it comes to national data, we have a hard time getting the data that we need through the Department of Justice. You probably all know this. The FBI National Crime Information Center provides some data. There are really no great sources from tribal governments. It would be great to get that. We've seen that there have been 3 or 4 reports by specific tribes, but the data is not readily available. In 49 states, and again, you might know this, in DC, they require reporting of missing children, and that's great. But only 36 states require reporting of missing adults. So there are some gaps in the way data is collected, and we encourage our colleagues and other agencies to try and make improvements there. So let's go to the next slide, please. So lastly, I just want to emphasize that we are trying to remove systemic barriers, and we are looking at those protocols and prototypes that might make a difference. And we're going to start with youth who are in treatment. And we kind of go through this program. I mentioned the UIO that is a partner with us on the youth work. That's the Native American Rehabilitation Association in Portland, Oregon. And we will be looking at protocol and prototype projects. There's 17 in total. There's a couple that are already tailored to American Indian Alaska Natives. So they've been vetted in tribal communities, or they're tailored to them in terms of affinity. There are many other prototypes that we think are going to make a big difference. They're in the works, and some that are still needing to be developed. The one at the bottom I want to just mention is the Safe Wayfinder. So this is one that we've defined the requirements for, and we hope to get built, but it's kind of like a safety app for youth or anyone who are moving around and want to avoid risky situations. So with that, I'll conclude. Thank you so much for letting me speak to you today.
So we talk about, we know that this is a chronic issue in Indian country and in our urban areas, but how do we address it? How can we decrease our numbers? What can organizations do to bring awareness, educate communities, to teach their community members to know their rights. And this is the part I would like to encourage you to either please put in the chat or take yourself off mute and just tell us what is your UIO doing to help decrease MMIP numbers. Some of our ideas are training to strengthen parenting and daily living skills so we can bring awareness. And in focusing in prevention, we want to talk about more training in trauma-informed care, and not only training on what is trauma-informed care, but how to use those tools and bring it back into your community and utilize it. The same as mental health first aid, and teaching mental health first aid, but also learning how to bring that back to your community and to implement that in your communities. Creating a circle of safety is something that some communities have been doing so that their community members feel comfortable in going to a circle of safety to talk about what their concerns are for their risks and what can we, what can we do to offer secure places for people to feel safe. The National Indigenous Women's Resource Center Advocacy has an information packet that is extremely helpful, and that is, I encourage you to, there's a link there. I encourage you to go there and print that off. It can be very beneficial to you. So on the next slide, please. So how many participants that are here today have established an intimate physical violence or domestic violence prevention program that addresses MMIP? Would anybody like to answer that question on what your UIO is doing? You'd have to come off mute to tell us what you're doing. Does anybody participate? I don't see anything in the chat. Is any UIO doing anything to decrease your MMIP numbers or have programs for your MMIP? Yeah, you can put it in the chat box too if you're more comfortable. Okay, so I hear continue awareness with workshops. That's good to our community. And safe places at a certain place. Safe places is extremely important because people don't know where can you go to speak to somebody in confidence, and it's very important to bring awareness to our communities. Let's go to the next slide. So in exploring promised practices for coordination of care, let's talk a minute about caseload and time management for DV programs. For those of you who have a DV program or a crisis response program, what do your caseload management numbers look like? What's your ratio per worker for your cases? Does anybody want to volunteer that information? Okay, well, normally we would say 16 to 20 cases per case manager is probably the norm. We want to make sure that people don't overload their case managers because the case manager needs to invest a lot of time into each individual. So it would be very important to make sure that the caseload management and your time management is extremely important for each organization. On the next slide, we have given you a list of resources, and this is the fact sheet. It talks about, if you see, these are really alarming rates that reported violence for American Indian and Alaska Native people in their lifetime, 81% of men and 84.3% of women. Missing people facts, on here you see 9,575 entries were made in the American Indian, Alaska Native persons in the FBI National Crime Information Center missing persons in 2020. 71% of those cases were American Indian or Alaska Natives under the age of 21, and it's required by law, it's required of law enforcement to report these cases to the NCIC. 43.1% of all these cases were females under the age of 18. 15.5% of these cases remained active at the end of 2020. Cases are reported closed when an individual is located by law enforcement, returns home, or the case is determined to be invalid. Some of these cases where individuals are found, but because of certain abuse that happened, they don't want to return home or they can't return home. So those cases would be considered closed too, even though the community itself might consider that person missing. And it is required of law enforcement to report cases to the NCIC, but not the same as adults. So that's why it's more important for data to become available on missing women and children, so that we can use this data for information and for grant writing. So on the next slide is also a list of resources of these resources are related to MMIP, and you have information on data and databases, primary prevention, and also legislation. These are all up to date, so I encourage you to spend some time going through this and educating yourself on all of the different resources that are available. So we talk about this problem, and now you say, what do we do about it? You know, so we're going to talk about funding. Funding is really important in trying to identify obtaining funding so that you can make these programs to build and strengthen your communities. So on the next slide, we're talking about, I'm going to turn this over to Sabu, talking about how to obtain funding for these programs. And if you have any questions, please feel free to put it in the chat box and we will answer them accordingly. Thank you so much for allowing me to be here today and talk to you. Sabu?
Thank you so much, Dr. Ito, for sharing on how to address MMIP and exploring best practices. My name is Sabu. I am a public health associate here at Nikui. I'm not tribally affiliated, but I identify as Indigenous, Egyptian, and Armenian. I want to kind of share and go over some tips, steps, and guides to navigating funding philanthropic sector by using also a mapping tool that we'll be going over to really help with identifying MMIP funding for your organizations. For many urban and tribal organizations, there's a lot of federal funds that are very restrictive, and there are private funds that are a lot more unrestrictive that could help with operations or even expanding certain programmatic support in prevention, programming for domestic violence prevention, or with cases around MMIP. So it's important when thinking about private funding of how to engage with a funder. And so today I'll be going over how to better prepare you all. And it's fine if you don't know. And if you do, I hope you learn some more knowledge that will better prepare you. So when thinking about approaching private funders, it's important to be authentic. As a Native person who's leading your Native organization, as a program staff, as a grant writer, representing your urban Indian organization or your Indigenous communities, it's an important piece to speaking the truth to power. So being authentic means you also are speaking of injustices, as Dr. Ito shared about some of these really difficult numbers out there around MMIP, it's important to speak truth to power when thinking about it from a factual place. Also, making sure that your Indigenous values, your organizational Indigenous values are aligned with that funder. So doing your homework, and we'll talk a little bit more about that in the next couple of slides, but making sure that your Indigenous values and your organizations align with that funder, because if they don't, there isn't even the space to have funding. And lastly, visibility. And we'll be talking about this a little more, but really, how are you visible? Do you have, you invest in your websites? Do you have a donation button? Do you have social media sites, platforms that funders could come and donate and see? So we're gonna go to the next slide now, which is an Indigenous researcher is going to share about the importance of uplifting Indigenous values from some of her research she did interviewing survivors. And so, Rachel, can you please play the video?
I got it, Sadhu. Just let me know if the sound's not working.
We didn't just do this research to hear about pain and trauma. We wanted to know what services the women needed and what they needed to heal. What we heard was an overwhelming need to reconnect to and strengthen their cultural knowledge and practices. I've been thinking a lot about that since then, and how many of us, Indigenous and non-Indigenous, are longing for that connection. One of our teachings is that we are all related, and that means that we have a connection to and with each other, as well as to our plant and animal relatives. Many of our cultures have universal teachings, values. For the Anishinaabe, we have the 7 grandfather teachings: love, honesty, trust, humility, wisdom, courage, and respect. I share these teachings as an offering of connection for all of us, Indigenous and non-Indigenous. Zagiduen, love. Much of the work that I do is done from a place of love. Love for my community, love for my people, love for my culture, love for my family, and love for myself. When we show up for each other from a place of love, we show up from a place of compassion and understanding, where we can support and encourage one another. When we come from a place of love, we can see possibilities and foster connection. But love is also about accountability. Not just the kind of accountability that comes from punishment, the kind of accountability that includes reciprocity. What could it look like to give back for what we have taken, to repair harm to those we have hurt, to truly express love for humanity and for each other? When we practice love and accountability for each other, we create possibilities to step into our full humanity. Goya Kwadaziwin, honesty. Honesty requires us to communicate with integrity and be true to our word. This is how we show up in the world. This is how we walk the talk. Honesty in our actions, and is very related to the next one, Debwewin, truth. Speaking our truth can be very scary. I have experienced many times in my life when I could hear my voice shaking when I spoke my truth. This is what was displayed through the stories that the women shared with us in our Garden of Truth research. Truth is also what was required by all the victims and survivors who have shared their Me Too stories. Inendizawin, humility. Humility is how we show empathy to each other. I see this as how we want to be in community with each other, being understanding and gracious in our interactions. Humility is knowing that even in our greatest moments, We are only one small piece of this bigger world. I am only one small piece of the whole, and I respect and honor what others contribute. I am both a teacher and a student.
I've given it back to Rachel for the presentation.
Thank you for sharing the video, and I hope everyone appreciated the video. This video really shared a lot of really important aspects, but one that I think stood for me was the importance of uplifting Indigenous values and being authentic and speaking from speaking truth into power as one of the points that this Indigenous researcher had shared. And so if bringing truth means bringing your own ancestral knowledge, and that's a value that you believe in, it's important to say it. It's important that it be in your organization. It's important that that's being expressed with the funder. Once you find a funder that aligns with your values and your organizational values. Because like I mentioned before, when that alignment is not there and they don't share that with your organization and with your Indigenous values, then funding won't be there. Next slide, please. Next slide. I also want to share some things to know when we're navigating the funding philanthropic sector that I think is important. I think we all know Native communities are very underfunded, and so even in the philanthropic center, this is the case where 0.4% on average of funding is directed to Native communities. So it's even more important to be visible, to educate funders because they don't know. And so those who have relationships with funders now know that it's a learning process. Even when they have values that are aligned with your organizational values, there's still going to be learning moments. You might have to do teachable moments for them in helping decolonizing stereotypes that they might not know of. So this journey really helps with building better relationships, and relationship building with funders is one of the most important things because funders have access to other funders, and if that relationship blossoms in a way that's helpful for both your organization and the funder, then you have option there. They introduce you to other funders, and then some other things just to kind of just share is like being able to making sure you do your homework in funding, understanding funding landscape. So if that means you got to sign up for newsletters for a specific funder to learn more about them and what they're doing, and so this is really just some bits that I wanted to just share with y'all. Next slide, please. So now I want to share an important tool that was created and is a free tool for anyone by Native Americans in philanthropy. It's data that captures funding across the nation from private funder sector with a variety of different areas that you could look into. So if you go to Native American philanthropy.candid.org, this is a free accessible tool for anyone. Next slide, please. So the main page you'll find is here, and you could press on the funding map section at the top. Next slide, please. And so the map covers funding for across the US. Unfortunately, it doesn't include data for First Nations region. So hopefully in the future, there's a more holistic picture that's collected there. And then next slide, please. So once you go into the map, you'll see this portal, and it's just this portal kind of just shares that this information that's being collected is through tax documents. So there might be a 2-year lag in some of the funding numbers based off of that. Next slide. Now, here is where you get to actually see the portal, and there's an option to see funders at the very top left corner of the screen to see what kind of topic areas there are that funding is being provided. And so for this specific session, I put the domestic violence programming, prevention programming, and there is 96 grants, over 6.6 million in funding, and it shows the recipients. Next slide. And once you click on funders, it really gives you the top, you'll see the top 3 or 4 funders that give the most amount of money to grantees or to folks in Native communities. So there is an option here at the very corner that says if you want to click as a filter out only Native specific funding, this portal does that too. And so you see here Tide Foundation and a few others. And so it's really just important to like kind of then learn about how and learn more about what that foundation does and how money, what kind of, who are they funding? So we'll see that in the next slide. Next slide, please. This is one example. I picked Blue Shield of California Foundation. They provide a lot of funding for Native communities there. And so the California Consortium of Urban Indian Health, as you can see, and Indian Health Council have received multiple year funding streams, so that you also get to see a trend of how foundations are funding Native organizations. So if they're funding them more than 1 year, you could see probably there's like a relationship built there over time, and it's blossomed. So there's stuff like that you kind of could learn, and also it gives you an idea of maybe how do I engage with this funder, right? Who might not I know in my network that I'd like to introduce us to them. So just some thoughts there. Next slide, please. And this is just another top funder, the Novo Foundation. They provided funding to various Native organizations across the country. So this is a more national one. So looking more into Novo and seeing if those values align with yours is like a cool thing about this tool. So next slide, please. So to ensure we have time for upcoming activity, I just want to go over this, briefly go over this power mapping for funder engagement. And if you can please possibly in the chat box, put like a thumbs up if you've heard of power mapping before. And if you haven't, it's fine. I was just trying to get people's thoughts on how that is. So if you put a thumbs up, that would be really great. But power mapping is different and there's so many different ways and models of power mapping. So it really comes down to like what best works for you and your organization in devising a plan, to engage with funders. So there's some steps here that I felt that would be really helpful. For example, like how do you end up getting to meet the CEO or program officer or board member on the Novo Foundation? That could help you create that engagement and a plan that will lead to hopefully something that's beneficial. So I like to see that there's folks here in the chat that have heard of power mapping, and for those who haven't, this is a really great step that you could kind of take in creating some engagement. And there's some other resources I'll be sharing as well. So shortly we'll be sharing that. Next slide, please. So I don't know why there where's the other images? But I wanted to just quickly ask folks with these 3 emojis, yes, the corn meaning yes, I'm confident we do. The unicorn, not sure, we'll get there in the future, or the steel, no, I'm not confident we don't. Just trying to see where people are at when we're thinking about a checklist, when we are creating engagement, like thinking about strategic communication engagement with private funders. So quickly asking folks, is your organization have visibility? Do you all have social media platform presence? Put your corns in if y'all do. If you don't and you're not sure, put your unicorns in. I'm starting to see a good mixture of yes, confident, or we'll be getting there in the future, and that's good. That's still a good thing. We'll get there in the future is also just as important. Really appreciate sharing that. And then some other things that wanted to just think of for y'all to think about, like, have y'all invested in like regular communications? So even though this could be like for a smaller organization, one person, it's important to invest in communication so that there is this space that the funder is able to quickly see and learn more about really a lot of the amazing things that your organization does that might be aligned with them. Next slide, please. And here I just wanted to just quickly just share on some things that I think would be really important is like making sure y'all have like a donation button. So please put in the chat about that if y'all have a donation button, but a quick resource is that I think would be really helpful is Act Blue. It's a service that takes 2% of fees, but they let you put donation buttons across any event that you have. They even give you the option of having it like monthly for people who want to pay monthly, like funders to your organization. So just some things there. And then really the last slide, the last two slides here, I wanted to just go over. Can we go to the next slide? Is there's some resources on how to find some grant funding. So the different types, whether it's corporate, foundation, government, where to find some of this funding. Next slide. Then here are really just a equally important resource. The Association of American Indian Physicians have this really cool proposal development manual and training, as well as a lesson plan on helping organizations write your proposals out that you want to maybe do for a funder. So I put this in here and these slides will be available. And on that note, I want to pass it over to Dr. Ito for our Padlet activity that she'll be navigating. You're muted, Dr. Ito.
Sorry about that. So has anyone accessed the Padlet the Padlet activity? Is anybody having any issues with that? See if we can go to the next slide then for the questions. Oh wait, let's go back to the. Can the Padlet be open so that we can see the questions on here? Can we show the questions on the screens for the Padlet?
I'm having a little bit of a technical issue. Does anybody co-host have that up by chance?
Yeah, I can bring it up. I'm just not the creator. But you're welcome to make Sabu the creator because it's just going to show. Oh, perfect. Yeah, it's up. It's showing now. We got it.
Okay, here we go. So if you can access this, please answer this on here so we can kind of get an idea. We want to know, Nikui wants to know what we can do to help. What can we help to our UIOs in programming and program development, and you know, what is it that we can do to help? So, excuse me. So how can we make a difference? I see advocating for DV clients. Does anybody else have any ideas on how we, not just the CUI, but how UIOs can make a difference in this population? I don't know if people are having a problem getting in or not being able to access it or just not accessing it.
Yeah,
So we talked about,
are folks having trouble typing into the comment sections for discussion? Okay, they're coming in, Dr. Ito.
okay, there we go. Yes, collaboration and training. For the people who said training, we want to know, what kind of training do you feel? And that's the next question. What are agencies doing to educate about MMIP? And what kind of other trainings do you think that you could benefit from? NCUI is going to be offering a series of trainings, positive Indian parenting classes, compassion fatigue, some classes on different kinds of domestic violence, and different kinds of programs. But what other kind of trainings would you like to see us provide, or you have access to? I see someone said DV and sexual violence, teen dating violence workshops is extremely important. So I think for me, offering teen dating violence workshops is a good way to prevent MMIP and further violence. Does anybody else have any other ideas on what your agencies are doing to educate, or what kind of ideas would you like to have to educate about MMIP to whether it's your staff or your community population? Anybody else would like to answer that question? And how many UIOs have policies already in your agency regarding MMIW or MMIP? Oh, I see somebody went back and put on what can we do to make a difference and more trainings. What you're doing now is great, and we have to conduct a needs assessment to now determine what we need on the information provided. Absolutely correct. So other people are saying what their agencies can do to educate, collaborate with other agencies. That's absolutely true. You know, the more we collaborate, the stronger and smarter we become. Forensic trainings, awareness on abuse, absolutely. And that's all very important. It's very important to have DV and SUD services, providing prevention resources through the Indigenous community. That's great, but no programming yet, okay? And someone else put in training for medical staff, how to talk to those affected and linking with resources and support. And that's really important because, you know, we want people, we talk to our community members about coming and asking for help. So when they finally do come and ask for help, you want to make sure they're talking to a person who is empathetic to what they're going through, and just say, oh, you know, okay, well, you know, you survived, everybody survives. We don't want that kind of conversation to occur, which it does happen a lot. So we want to make sure that those people are going to, you know, victims or survivors or people who feel that they're at risk go to ask for help. We want to make sure that they're getting quality information to help them. So when we have, someone wrote on there for the, do you have a policy in your agency? We do not. What would a policy look like? So a policy would be where you're writing up a protocol. If I came to your clinic or if I came to your organization and I told you that I feel that I'm at risk for being trafficked or I'm at risk for domestic violence, so it's a protocol. So what would you do if someone came in and said that? The same as a suicide prevention protocol. What would you do if someone came in and said they were going to harm themselves? And that's what the policy would look like. And we have on the NCUI website, we have some policies for this, and you can easily look it up on our shared drive. We also have a program right now for emergency planning where UIOs can join a one-year project, and by the end of the year, they can get an emergency planning manual prepared specifically for their agency. So if you would like some more information on that, it's called the Storyteller Project. So if you're interested in making policies and procedures for your organization that are around emergency planning, please leave your name and contact in the chat and say that you would like information about the Storyteller. We still have 3 slots open, and we would welcome you if you want to develop an emergency planning manual. We would love to have 3 more UIOs to participate with us. Someone wrote in here, what are the parameters of such policy? You know, it depends on what your agency is, what your risk, what you feel that your community risk factor is. And so that's a really difficult question to answer without knowing more information. So again, if you would like some more information, please feel free to contact me. I will put my email in the chat, and you can please feel free to contact me, and I can assist you in understanding what your particular parameters would be for your policy for your community. So so question number 4 is, do you offer specific training that educated your staff on MMIP crisis? And some people are saying, no, unfortunately we don't, but we could use it. We do not, we would love to do this. We do not, but I am interested. And no, but would like someone to come in and teach our staff. So I urge you to keep an eye out on the NCUI website, because in March we will be offering Positive Indian Parenting classes, which is a 2 4-hour class. And then we will also be offering domestic violence, compassion fatigue in July. So we are going to be, as part of our MMIP project, we will be teaching classes for our UIOs. So you're more than welcome to contact us about that. We would welcome your participation in those classes. And if there's some other training that you feel that you would like, but you can't find it, let us know, and I will be happy to, my team and I will be happy to search for that. Anything that you feel that you need, just let us know how we can help you. So we put on here, what types of training, question 5, what types of trainings or activities would you like to hold regarding MMIP? And, you know, we talked about the trainings today. So again, I urge you to keep an eye out on the NCUI website. We'll be having our sessions on there, and you'll have any UIO, either staff will be able to participate in these trainings. And if you feel that, you know, we're offering some trainings, but you need something else, again, let us know, okay? And these trainings will be recorded so that if people aren't able to actually go to the live class, you'll be able to watch the classes at a later date.
And we also have a TA submission link that if your organization needs technical assistance, we could provide that in a link to that you could submit, and we could like follow up on too.
Does anybody have any questions that I can answer before I give this back to Sabu? You can feel free to come off mute and ask. I hope I can answer, or put something in the chat. So for those of you who are putting in the chat that you would like some more information regarding the Storyteller program, we'll make sure, just give us your contact information and we'll make sure that we send you out an information sheet and an application, very short application. It will take less than a minute of your time. Any questions? Well, I sure do thank you for coming today and attending. And again, if there's anything that we can do to help our UIOs, please feel free to reach out to either Sabu or myself and let us know. And again, for those of you who are interested in the Storyteller program, we'll be sending you out some information today.
Great.
And
And
these are
just,
upcoming. Oh,
oh,
sorry.
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 You can
No,
go
go
on.
ahead. No, I'm sorry.
Yeah, so if there are no questions, I just wanted to give a big thank you to our speakers today, Dr. Ito, Dr. Pashane, and Sabu, and also thank you to all of our participants who gave us feedback and shared what some of your needs might be in our Padlet activity. We do have a lot of upcoming sessions that you can take a look at here. As Yvonne mentioned, or Dr. Ito mentioned, there will be positive parenting training coming up in March, but we have a host of events happening weekly, and you can always find those on our website as well. Next slide, please. And as always, your feedback is super important to help us make our sessions better, but to develop ideas for new topics as well. So we appreciate any feedback you can provide us. You can take your phone and you can scan that, and Molly will drop a link in as well. By participating in the survey, you have an opportunity to be entered into a raffle for some Nucleus swag, and I think we're giving away a mug and or a blanket. So if you could complete the survey either today, or if you have to jump off, you have until January 31st, the end of the month, and we will enter you in a raffle and appreciate that that feedback. And again, thanks for coming today. And we hope to see your event in the future.